Talking about vaginal odors and vaginal discharge is a subject that most women would find embarrassing, but we're going to talk about it here in depth. What does it mean when you have a particular vaginal odor based on the type of odor and based on the type of discharge? As you might already know, there's a wide range of normal vaginal odors. And then there's also the type that you might need to get checked out, right? Does it smell fishy? Does it smell like bread? Does it smell like metal? Does it smell like rotten flesh? What does it smell like? Or does it not have an odor? We're all going to cover that in this video today. But before we do that, I have a video clip that I want you to watch. Please just watch it to the end.
Have y'all seen the viral video going around about the girl who went in to go get her cuckoo waxed? And the girl mid cuckoo wax says, I can't do this anymore. I can't do this. And the girl starts her camera. The girl getting the wax starts her camera and she's like, so why can't you? And she says, because she's going to blast her on TikTok, you know, as a bad business owner. She's like, because I cannot, that smell is not normal coming between your legs. And the girl's like, it's because I just worked out. She's like, honey, you did not just, like, that is an infection. You need to go to the doctor. And the girl still continues to be like, no, that's not it. You're a horrible business owner. How can you do this? I have to get this done because I'm leaving out of town. Nobody can do this last minute. You're a horrible person. And the girl goes, I'm sorry, I literally just cannot. Like, that smell, I cannot do it, honey. I cannot. You need to go to the doctor. The girl still continues to argue with her and be like, that's ridiculous. You're a horrible person. And I'm over here the whole time being like, honey, you are trying to blast her, but you are blasting yourself. If your coot smells that bad, you do need to go to the doctor. She was being a girl's girl. And honestly, I know, I can only imagine, because listen, I can't do smells. I can't do smells. I can't do it. So if I was in that woman's position, maybe she's the same way. She's like, I can't do this. I can't do this. And I don't know if y'all have ever gotten one of those, but I go every month and they don't wear masks. Okay, so they're down there all willy-nilly. Listen, I know that girl was trying to make it so that we would all be mad at the girl. I'm not mad at her. I feel bad for her.
Okay, now that you've watched that clip, if you're like me, you're wondering, where's the original video? She was talking about an incident that happened to somebody else, but where's the actual original video? I wanted to really see it, so I went looking for it and it wasn't hard to find, and I'm going to include it here. So watch it, pay attention to what they're saying to each other, and we're gonna come back and talk about it.
Why are you putting this stuff away?
Ma'am, I feel like you're putting me in a position where I have to continuously tell you that that's an issue that you have. This is beyond going to the gym.
No, I just came from the gym. I'm trying to get my wax. I have vacation. My flight leaves tonight. And I need my wax done. And now you're telling me that you can't do my wax because of a funky issue. It's crazy because I've gone to other places. I've gone to European Wax Center and they don't have an issue. The phone's going off. This is so unprofessional.
I do apologize.
This is so unprofessional.
However, that is beyond. I don't know what. Maybe European Wax Center is a little bit more equipped than we are. However, I don't feel comfortable. I'm actually a CNA as well, and that is not just an odor. That's actually an infection.
Excuse me?
That's an infection.
I don't have an infection.
And I don't feel comfortable touching you in that area.
I told you I just went to the gym. I just went to the gym.
Ma'am, that's not the gym. That's not the gym, ma'am. I go to the gym. That's not the gym. That's not the gym.
You don't go to the gym.
This is a very uncomfortable conversation for me. I'm not your primary
You don't go to the gym. I can tell by your body type.
Excuse me. I am not going to accept insults from you because I'm not insulting you.
You haven't seen a gym.
Excuse me.
So you are embarrassed
now.
So you wouldn't
you're
know
going to try to put me down.
You wouldn't know what an odor from the gym smells like if you don't go to the gym.
You are completely. I'm going to have to ask you to leave. We cannot provide a service for you.
It's too late for me to book last minute anywhere else. Everybody else is booked. I got this off a Groupon.
Ma'am, you need to go to the doctors. This has nothing to do. I don't even know why. You should not get on that flight.
This is crazy.
This is embarrassing. I hope you're not going with the man.
This place is embarrassing. You got this bum Easter grass. Look at this place. Look at this place. No, look at this place. Look at this place. I'm going to show Groupon. Don't touch me. Don't you.
Before we get to the medical part of this discussion, I wanted to know from your opinion on a social level, based on your culture and etiquette, and based on what you heard, do you think the wax technician was at fault in the way she handled the situation? Or do you think the customer had unrealistic expectations? Would you have handled it differently? How would you have reacted if you were in that situation, either as the client coming in for a wax or as the wax technician herself? What do you think? Comment down below. All right, now we're going to talk about the medicine part of it, because for those that don't know, I am a US licensed medical doctor. Even though most of the content you see on this channel is lifestyle related, I try to bring educational videos every now and then. Okay, big picture. So when it comes to vaginal odor or how it smells down there, it's affected by several different factors. It can be affected by infection. So obviously, if you have an infection down there, it's going to smell differently. Also, hormonal changes. If you've ever been pregnant or if you've gone through menopause, you may notice a difference. Also, based on your medications. So medications can definitely affect how it changes or smells down there. Also, certain foods, so your diet, poor hygiene. Editing Habiba here, or Dr. Tanau to you today. You'll be surprised at the number of young females who don't know how to take care of their bodies or how to clean themselves properly because their mothers or family is uncomfortable talking to them about their bodies. All right, I'm going to try to go through these different odors and different discharges and what they mean fairly quickly. So number one, if it smells like rotten food or rotten garbage, that's a very distinct smell, and that usually suggests an old tampon or a tampon that has been left up there for too long. So just think about the smell of old blood mixed with vaginal secretions, mixed with bacteria. That can cause the smell of rotten food, and it's very distinct. And this is something that's not very uncommon for women who wear tampons. Sometimes they leave it up there too long, or they forget, or they can't take it out because it's been pushed up there too far. And that is definitely something that needs to be addressed or attended to by your OBGYN or GYN and or your primary medical doctor, because if a tampon is left up there for too long, you can develop toxic shock, which is a very dangerous and life-threatening condition. So yeah, any smell that smells like rotten food typically suggests some foreign object up there, like a tampon that has been left in too long. What if you feel like your vaginal discharge smells metallic, which can often be the case after your period or right before your period ends? And that's really because of the presence of blood, which, as you know, blood contains iron, which gives off a metallic scent. So it's very typical during your menstrual cycle. Nothing to be alarmed about, as long as you're not having any other significant symptoms like, pelvic pain or heavy bleeding or heavy discharge. Okay, what about if it smells fishy? What does it mean if the odor is fishy? Well, if it smells fishy, typically that suggests bacterial vaginosis, although there is another reason why it could smell fishy, and we'll talk about that in a minute. But typically, bacterial vaginosis is the reason why it smells fishy. Let me just say, bacterial vaginosis is very common in many women, and it is not a sexually transmitted disease. Even though it can be passed during sexual intercourse or because of sexual activity. But even a woman who has never had sex before, or a young lady that has never had sex before, can get bacterial vaginosis because it's an imbalance between the good bacteria and the bad bacteria, okay? And douching does not help. So typically, bacterial vaginosis will require medication from your doctor. So please see your doctor if you're having a fishy odor with a discharge. The discharge could be clear to gray, and again, that would require medication. Also, with bacterial vaginosis, you may get some burning with urination and also some itching. So you get burning with urination, itching and also possibly a vaginal discharge that might be whitish to grayish in color or light gray in color. It's important to note that your vagina typically would like to maintain a pH of about 4.5, which is pretty acidic. And so to maintain that pH, one of the things you might want to discuss with your doctor if you're getting bacterial vaginosis or other infections or problems down there is taking probiotics. So discuss that with your GYN or your primary medical doctor, taking probiotics, because probiotics will help maintain that balance of good bacteria so that the bad bacteria doesn't overpower the good bacteria and you end up with a lot of yeast infections or bacterial infections that cause problems. It's also important to note that 50 to 75% of women who have bacterial vaginosis may not have any symptoms at all. So another reason for fishy odor down there is trichomoniasis, or you've heard of trich, which is a common sexually transmitted disease. And that will present with burning with urination, itching down there. You might have a discharge, yellowish green discharge. So it can be uncomfortable, not only during urination, but also during intercourse. And again, it has a yellowish green discharge that will require treatment. So you will need to be tested for other sexually transmitted diseases, and you will need to be treated with antibiotics. Another sexually transmitted disease that can have a yellowish green discharge, as you may know, is gonorrhea. So gonorrhea will also have a yellowish or greenish discharge, and also sometimes a fishy odor or an odor that's described as mushroom-like. So typically when you present with a discharge that color, you are usually checked for gonorrhea and chlamydia as well, or your treatment will also involve both of those STDs. I also want to remind you that it is quite normal to have a vaginal discharge. If the vaginal discharge does not have an odor, or the odor or scent has not changed and is your normal, and it tends to look either clear or white, then that is considered normal, especially if it hasn't changed for you. It's your typical. Usually you can tell something is abnormal when the odor is really strong and it appears to have changed. So what does it mean if the discharge smells like bread, or basically yeasty? You have a yeast infection. So if the discharge is thick and creamy or clumpy, then that is a yeast infection. And typically with a yeast infection, the area is going to be very inflamed, red, very, very itchy, very, very uncomfortable. And why you would get a yeast infection, there are many reasons why you can get a yeast infection. You can get a yeast infection because the area down there is overly warm and moist, and so it has created the right environment for yeast to take over, because either you were on antibiotics. So I know many of you realize when you take antibiotics, you may get a yeast infection. So antibiotics might be a reason for a yeast infection, but another reason for yeast infections are also pregnancy, because during pregnancy and the hormonal changes, the pH of the vagina may change. Also, people who are diabetics are more likely to have yeast infections. Also, people who are working out and, they're sweaty, they're hot, and they're not taking off their gym clothes as soon as they finish working out or taking a cool shower. They sit in the wet, hot gym clothes. You're more likely to get a yeast infection, right? Or you go swimming and you stay in your wet bathing suit, so there's a lot of moisture close to your body. You're more likely to get a yeast infection. When it comes to yeast infections, there are so many different over-the-counter products available from your local pharmacy, such as like Monostat. You can also get a prescription medication that is stronger from your GYN or your primary medical doctor. You can take an oral medication or vaginal medication. So definitely see your providers for that, especially if you are getting frequent yeast infections. You might want to be tested for other conditions. What if you have a really foul odor down there and a fever? So you have a really foul vaginal odor. You can't put your finger on it, but it smells really bad. And you have a fever of above 100.4 degrees Fahrenheit. And you're having pain in your lower abdomen. And you might be having pain with intercourse. So you have this foul odor, a fever, and pain. What is your diagnosis? Well, what you probably have is a very serious condition, pelvic inflammatory disease, and that is something that needs to be attended to as soon as possible. So if you're having a discharge plus pain plus fever, please call your doctor as soon as possible. This is not something you want to just sit on, because this is likely due to either a serious bacterial infection like gonorrhea or chlamydia, and if not treated, this can cause severe and permanent damage. So women that have a lot of infections that go untreated for long periods can end up with fertility issues later on and chronic pelvic pain. It also suggests that the infection has gone from the vagina up to the cervix and up to your other reproductive organs. So definitely something that you want to address very quickly. What if you think your discharge smells like bleach or like chlorine down there, especially after intercourse? Well, that is more likely due to the condom that you may have used or due to the lubrication that you may have used. And it just means that next time you might want to use something that is unscented. So definitely not something you want to worry about if you think, again, it smells like bleach or it smells like chlorine after intercourse. What if you think you smell musky? You think you smell musky, or you think your lady bits smell musky. Well, our bodies smell differently depending on our activities, especially if you're working out or if you're sweating or you're very active, or again, sometimes during the wintertime, you might be wearing a lot of layers. Remember, your vulva also has sweat glands. So if you are sweating and if you are, active and there is a lot of moisture down there, it is likely you're going to smell musky, not just in your lady parts down there, but also in your armpits. And if you're also very well endowed under your breasts, different parts of your body probably smell musky, not just down there. So I would suggest, obviously, you take a shower or you take a bath, and you might also want to get a pH balancing gel. There's so many on the market, and there's so many feminine hygiene products, and there's so many different deodorants, products like Lumi that you can use. What about a vaginal discharge that smells sweet? Is that really a thing? Well, apparently there's no science to, quote, prove it, but it is well believed that what you eat can affect how you smell down there. So eating certain citrusy fruits like oranges, and I'm sure you've heard people talk about eating pineapples to make down there taste sweet. If you are a normal, healthy woman, it smells just fine the way it was designed. So we said she can smell sweet, but she can also smell pungent, right? So just like I said before, certain foods can affect how you smell. And eating a lot of onions and garlic, which I will say are very healthy, very good for you, but eating them in excess can sometimes cause your vaginal discharge to smell pungent, just like other parts of your body. So it's not going to be just the vaginal discharge, but also it comes out through the sweat. We have sweat glands all over our body, again, including your vulva, under your armpits. So when you are eating a lot of onions and garlic and you sweat, some of that odor is going to come through, and you might end up smelling pungent. So finally, how do you reset your vaginal pH and keep her healthy? How do you, maintain a good balance down there? Well, number one, drink plenty of water. As you know, dehydration is not good for any of the organs in your body, and certainly not good for your vagina either. So make sure you are staying very hydrated. Number two, make sure you're eating foods rich in probiotics. Again, have that discussion with your primary medical doctor to see what they think, or your GYN, what they think about probiotics. But eating foods rich in probiotics, I think, is very important, such as kimchi or kefir, yogurt, pickles, sauerkraut. Foods like that are rich in probiotics. Again, on the subject of resetting your vaginal pH, but also protecting your life, please, I don't need to remind you, use protection, use a condom, practice safe sex, okay? Especially if you're not in a monogamous relationship or committed relationship. Gonorrhea, chlamydia, trichomoniasis, HIV, herpes, it's all still out there, so protect yourself. Also, I would avoid douching. A lot of these products have a lot of chemicals in them. So can you imagine having an infection or irritation up there, and all you're doing is introducing artificial chemicals into your body? Perfumes, none of these things actually help treat or control the problem, if there is one. And if anything, you are disrupting the pH of the vagina. So you don't want to do that. You don't need to douche. Your body is designed to take care of itself. She is equipped to clean herself. All you need to do is make sure that you wash her properly on the outside. So avoid putting soaps all the way inside into your vagina. Your job is to clean the outside, the labia majora and the labia minora, but avoid putting, again, chemicals all the way up through the vagina, because it's not necessary. So in short, use gentle cleansers to clean the vulva, nothing harsh, okay? Next, take your supplements and vitamins, and this is not exclusive to your vagina, but really for the good of your whole body, right? So yeah, make sure you are taking whatever necessary vitamins you should be on. Make sure, again, you discuss that with your primary medical doctor, and that you've had your labs, and that you know what you need to take. So personally, I take, for example, vitamin D. I am a woman over 50 who happens to be black, and a lot of us tend to have vitamin D deficiencies. I also take my vitamin C because that's good for, colds and the immune system, especially during the winter season. So, some women also need to take iron, etc., etc., etc. But definitely make sure you discuss that with your GYN or primary medical doctor. Also discuss taking probiotics, which again can help maintain the natural pH balance of the vagina. Another supplement some women really believe in is taking garlic tablets. That's not something personally I've done, but I do believe in eating garlic or cooking with garlic. And overall, I know that that's very healthy. And finally, managing stress. We know that stress is very dangerous, not just to your physical health, but also to your mental health, right? It affects your productivity, it affects your moods, it affects how you are able to function. So make sure you are managing stress well, because when you are overly stressed for long periods of time, you are more likely to get sick. The more stressed your body is, the more difficult it is to heal from an infection or to heal from an illness. So make sure you're getting enough rest, make sure you're managing your stress really well, and take care of your body. So I hope this video was helpful, and that I've given you the big picture that not all vaginal discharge is the same. You need to know what the other symptoms are, the color of the discharge, are you having fever, are you having pelvic pain, are you sexually active, are you using protection. All of these things or factors affect what kinds of infections or vaginal discharge you can get. Again, just because it's the holiday season doesn't mean we should stop taking care of our bodies. If anything, we should do even more now, right? Because we want to be here for a long time to celebrate with our family and friends. So take care of your body, and I will see you soon. Bye.